Well, good morning, everyone. The big deal is me being able to call Dr. Aurora a friend. My father believed in him. He trusted him. My father was able to learn from Dr. Aurora and understand the magnitude of this important vision. And so it's with that, Dr. Aurora, that I know we are all big fans of yours. And so I thank you very much for that kind introduction, and thank you and the University of New Mexico for inviting me to be here today. And I thank everyone from traveling from all parts of the world to be here in our beautiful state that I'm so honored to call home. I'm thrilled to be here at the 4th annual MetaECHO conference, and personally that New Mexico is the host. This matters to us, and especially with the understanding of the work that has been done in this important space. There is something about being surrounded, not just by thinkers, but also innovators and doers, that gives me great hope about the goal that we all share: to dramatically and drastically expand healthcare to every corner of the world. Some of you may not know this, but I first learned about Project ECHO, as was described by Dr. Aurora, when my father was the Speaker of the House here in New Mexico. At that point, it was much more of a project than an echo. Even more so, it was hope. A hope that a dedicated group could help patients receive the best quality health care no matter where they lived. So what started as a single idea, using Skype, and some of us still use that, to improve the health of hepatitis C patients in rural New Mexico, has transformed into a worldwide web of knowledge, power, and possibility. And all of you here today are a testament to that hope. And as a testament that the sound of Dr. Aurora and his team's hard work has indeed echoed around the globe and turned into a movement. Because there's no question that telemedicine is changing the face of healthcare. Globally, we are seeing an explosion in technology to connect people who need help and who are connected with people who have the expertise to provide the care. We've brought care and treatment and health to places in the world that previously went without. And I'm proud to say that your work is evolving. You're not just treating the sick and curing the ill. You are providing a new platform for equality and justice in medicine that every country and every human deserves. That's okay to clap at. I'm confident that everyone in this room, myself included, is here because we want to bridge those gaps of inequality. We want to see more justice and access. That is the goal that guides my work in healthcare in Congress. The idea that healthcare should be affordable no matter how much money you make, that healthcare should be accessible no matter where you live, and that healthcare should be high quality, no matter how you are insured. I know that telemedicine is one of the avenues that will transform this hope into a reality. Another important avenue is the commitment everyone in this room has made to touch 1 billion lives by 2025. What a goal. What a purpose. When I was thinking of what to share this morning and how to celebrate a group of visionaries who have put others before themselves, I kept returning to the idea of how many lives will be changed and transformed just because you're aiming high. I think we all know if you are going to try something hard, there are going to be times where you do not succeed. There are even going to be times where you do everything right and you still come up short. That's true whether we are talking policy, politics, surgery, or entrepreneurship. Like all of you, I have lots of responsibilities. I'm a son. a brother, a friend, a member of Congress. And if you ask my mom, she might even call me a gardener. And like you, I win some and I lose some. Last year, President Trump signed one of my bills into law. I'm a Democrat. One of them was legislation that will help states retrofit their Medicaid programs to better utilize telehealth for substance use disorder treatment. That's a win. But do you know how many bills I authored that were not signed into law last Congress? 46. 46 bills that hold promise and potential. Bills to connect tribal libraries with faster internet, to help families pay for college, to improve our behavioral infrastructure across America, and invest in housing in communities across the country. But I try not to focus on what I and my team didn't get signed into law. Instead, I focus on what conversations we started, the movement we made, the fact that issues that were previously ignored are now being fought for in Congress. That's progress, and that matters. Now, I know I'm preaching to the choir a bit. Everyone in this room has already dedicated themselves to improving the lives of others. You've all made such a difference. You pushed medicine forward. You pushed health forward. You pushed justice forward. So I want to take a moment to applaud your successes as much as I want to encourage your goals, because your goals are transforming health and medicine for people who need it most. Because I, like all of you, are here to get things done. We're here to inspire and create change, not to focus on the accolades. Something that I learned is to worry less about the title and worry more about what to do. Because when you're more worried about the title, you're likely going to miss the opportunity to act. Sure, some people may succeed in chasing titles, but when they get there, they don't know what to do with it. And if they don't get there, they don't have anything to show for it. But if you're worrying about improving access to substance use treatment in low-income areas, increasing the number of fellowship-trained physicians in rural communities, or touching 1 billion lives by 2025, well, everything you're doing in pursuit of that goal is worthwhile. Thank you again for letting me share a few words with you today. Dr. Aurora, thank you for believing that there was a better way to help people in need. And I want to thank each and every one of you here today for hearing that echo and amplifying it. Thank you for the honor of allowing me to share a few words. And here's the thing, I look forward to coming back in 5 years and celebrating once you touch those billion lives. Congratulations to MetaECHO and the work that you're doing day in and day out. Thanks for having me.